If you've been feeling a little bit off lately and you're not quite sure why, it could potentially be your hormones. In this video, I'm going to be sharing with you 14 signs and symptoms that your hormones may be out of balance. And if any of these resonate with you, then I'd highly encourage you to go and speak to your healthcare practitioner so that you can get some tests done and so that you can understand what is going on with you and get to the root cause so that you can start healing and feeling better. If you are new to me, hi, I'm Dr. Carmen, an integrative medical doctor and hormone health coach, helping you fix your period naturally. And if it's not your first time here, then welcome back. I'm so happy that you came to join me in this video. Now we're going to be diving into 14 signs and symptoms that something might be off with your hormones. So let's jump right into it. Number one is hormonal acne. Now we all know that when you go through puberty, you may experience acne breakouts. And generally speaking, this can present as pimples or blackheads, whiteheads. But hormonal acne is really concentrated on the lower part of the face, so the sides of the cheeks and on the jawline and the lower chin. And this is really caused by a fluctuation in your hormones that results in the increased production of sebum, which is that oily substance on the surface of your skin. So the combination of sebum and dead skin cells, together with the bacteria on the surface of your skin, will clog up your pores and acne will develop as a result. In some instances, people can have really severe acne, known as cystic acne, which is where you get really large, deep lesions on the skin, and they're very painful. The skin is very red and inflamed, and it can actually negatively affect your self-esteem and cause you to feel very self-conscious. Now, some level of skin irritation and the occasional breakout, especially when you're coming up to your period, can be considered relatively normal. However, if you are having frequent breakouts and your skin is constantly inflamed and your skin never tends to clear up in between breakouts, then this may be as a result of your hormones, in particular if you're experiencing acne in that distribution on the lower face. Now, this can oftentimes be due to an increased level of androgens. Now, androgens like testosterone, for example, will ramp up the production of sebum on your skin and make it more acne prone. This is a common feature in people who have polycystic ovarian syndrome. And this is because in polycystic ovarian syndrome, we often find that androgens are in excess. And this can lead to a number of features, including acne. So if you are experiencing acne on the lower part of your face, then this may be a sign that your hormones are out of balance. Number two is hot flushes, or some people call them hot flashes. But hot flushes are generally associated with menopause. And it's really this sudden feeling that the body is heating up. Some people may even experience blotchiness and redness on the skin. You may even begin to sweat. Some people will say that their heart beats really fast when it's happening. And they really feel like flustered and overwhelmed in that moment. Another thing that may happen when you are experiencing a hot flush is you may be overcome with anxiety, almost similar to a panic attack. But again, generally speaking, we associate hot flushes with the menopause. However, not everyone who goes through menopause will experience hot flushes, but generally this is a reflection of the fluctuation in estrogen levels. And so there are some things that you can do to better manage the symptoms of hot flushes. And maybe we'll discuss that in an upcoming video. You can let me know in the comments if you'd like to see a video speaking about how to manage hot flushes. But hot flushes are generally associated with changes or fluctuations in estrogen levels associated with the menopause. Some people will experience hot flushes and night sweats. And so it is important to pay attention to when you're having your hot flushes. Is it only at night? Because hot flushes at night together with night sweats may be an indication of something completely unrelated. And I definitely go and speak to your healthcare practitioner if that is happening to you. Number three is feeling tired all the time, right? So low energy levels. Now there may be a host of different reasons why you may be feeling like you're just completely flat and burnt out. But when it comes to your hormones, it may be an indication that your body is burning out and that your adrenal glands have been under a significant amount of stress. Your adrenal glands produce your stress hormones. And when your adrenal glands are working overtime to manage all the stress that you are under, in some instances, you can actually start to experience burnout as a result of that process. And so you may be feeling really drained, really tired, just low energy levels all the time. You may wake up tired in the morning, feeling like you haven't slept a wink. You may go to bed feeling exhausted and then still not feel like you're having a good quality sleep. And you may require an energy boost throughout the day. Maybe you're relying on coffee or energy drinks to kind of keep you going. These are all signs that your energy balance is off. Now, this may also be a reflection of unstable blood sugar levels, and this can commonly occur in insulin resistance, where you have these spikes in blood sugar and then crashes in blood sugar afterwards. And it can really feel like you're on a roller coaster. Sometimes you feel extreme fatigue throughout the day, and you really feel like, you're trying to walk through concrete just to make it through your daily activities. And so it's very important for you to pay attention. Are you just feeling a little bit run down because you've been a bit stressed recently? Is there a good reason why you're feeling so tired? Because you may just need to get some rest and then feel better afterwards. But if your energy levels are constantly low, then it may be worthwhile to take a closer look at your hormones. Number 4 is mood swings. Now let's face it, we're not going to feel our best all day, every day. We will have some normal fluctuation and variability in our mood. But oftentimes when we look at mood swings associated with hormone imbalance, these fluctuations in mood can often be extreme, unprovoked, and really unpredictable. And so you may even notice that your friends or your family have picked up that you're a little bit snappy and progressively more irritable with them. It may even begin to erode your relationships as a result. You may be unnecessarily harsh or mean or angry with the people that you love and care about. And perhaps one or two of them have even brought it to your attention. Now, we all know that when hormones fluctuate, there is going to be a resultant effect on the mood. We know that people, for example, who are going through puberty, there's a massive fluctuation in your hormones during that time. We also know people when they get pregnant will experience fluctuations in the mood, perhaps crying for no apparent reason, for example. And we also know that when it comes to the menopause, feelings of low mood and sometimes anxiety can start to bubble under. But generally speaking, we don't expect such extreme fluctuations in the mood throughout the rest of the menstrual cycle. And so if you are noticing that you're finding it more and more difficult to control how you're feeling and how you express the way you're feeling, if you notice that you're becoming more reactive and that little things irritate you perhaps more than they did before, perhaps it would even be helpful to kind of journal about how you're feeling and have a look and see if there's a pattern that's starting to develop. But paying attention to those extremes in mood fluctuation is important. And especially when we're thinking about hormone imbalance, it's one of the telltale signs that something just might not be right. Number 5 is period problems. Now, here we're talking about anything that falls outside of what we would normally expect for the menstrual period and the menstrual cycle in general. And unfortunately, for many of us, we've been conditioned to think and believe that period problems are normal. And while they may be common, they are certainly not normal. So here, under this umbrella of period problems, we'll see everything from a period that's gone completely AWOL, a very heavy period, very painful periods, irregular periods, and erratic periods, unpredictable periods. Extreme PMS, or feeling very sensitive and moody with breast tenderness and extremes in mood fluctuations just before you get the period. So generally speaking, your period should last for your bleed days between 3 and 7 days. Anything over 7 days is considered long. Now you may have a little bit of spotting before the period flow starts and perhaps a bit of spotting after the period flow has ended, but generally speaking, a bleed from 3 to 7 days is considered normal. You also shouldn't be losing more than 50 ml of blood during your period. If you're at a push, up to 80 ml of blood. But if you're losing more than 80 ml, then that is considered menorrhagia, or a very heavy period. Also, if you're bleeding between your period, something known as metrorrhagia. And these are all signs that you may not adequately be producing your essential hormones to produce a healthy period. And so we know that, for example, fluctuations in estrogen and progesterone levels, and including if you haven't ovulated. So really where we produce our hormones is during ovulation. And if you're not ovulating, then you aren't going to produce progesterone. If you aren't producing progesterone, then it's more likely that you're going to bleed for a longer period of time. And so all in all, if you are having any period drama whatsoever, I would highly recommend that you go and speak to your healthcare practitioner. Number 6 is weight gain and difficulty losing weight. Now, especially if you haven't changed your eating habits recently and you're pretty much doing the same thing you've always done, but you just notice that you're gaining more and more weight and that it's difficult to lose weight, then this may be an indication that something is off with your hormones. In particular, we see this happening where there is insulin resistance and unstable blood sugar levels, but also it may be associated with abnormalities in your thyroid gland. In particular, this is quite common in polycystic ovarian syndrome. Sometimes people with PCOS will write to me and say, I just look at food and I start gaining weight. And so if you've noticed that you're suddenly gaining weight or it's difficult to lose weight, then this may be an indication of hormone imbalance. Number 7 is low libido. Now, your libido will be affected by a number of different reasons that may not necessarily be hormone related. For example, if your relationship is not in a good place, or even if you've been diagnosed with a chronic medical condition. Let's say you are chronically in pain. Even some medications can affect your libido, and even if you have mood instability like depression. But we definitely see that people with low levels of estrogen, progesterone, testosterone, and even abnormalities in your thyroid hormones can all lead to a loss of libido. Interestingly, we also see a loss of libido in people who are on hormonal contraception, which seems a little bit counterproductive if you're taking contraception for birth control. But anyway. Number 8 is vaginal dryness. Now, vaginal dryness can lead to a number of different things, like a loss in libido and discomfort and pain during intercourse, as well as slight bleeding during intercourse. And it may even put you at higher risk for contracting urinary tract infections. And ultimately, vaginal dryness is associated with a drop in estrogen. Number 9 on the list is infertility. Now, there are multiple different causes for infertility. Some of them have nothing to do with your hormones. But we know that in order for you to conceive, you need to ovulate. And in order for you to ovulate, your hormones need to be working optimally. And so if there is an imbalance in your hormones, this may lead to anovulation, which basically means that the egg is not released from the ovary. And so infertility may potentially be a sign that there's something wrong with your hormone balance. Number 10 is hair loss and or excessive hair growth. In particular, hair growth in places where you don't want your hair to grow, right? So I'm talking about on the upper lip, on the jaw, on the chest, on the abdomen. These are all places where generally as women, we wouldn't expect or we wouldn't want to have hair growth. But this paradox generally tends to happen in people with polycystic ovarian syndrome. They'll experience hirsutism, which is where you have excessive hair growth in those places where you don't want to have hair. And then they also experience hair loss, in particular on the top of the head. And this occurs, both the excessive hair growth and the hair loss occurs because of excess androgens. Excessive androgen levels may be at the root of why you're having issues with your hair growth. You may also experience hair loss if your thyroid hormones are out of balance. Number 11 is intense cravings. Now, it's normal to crave different foods from time to time. Perhaps you haven't eaten something in a long time. There's a lot of reasons why you would crave a certain food. It may be because you need a bit of comfort. You may even be experiencing nostalgia, and maybe you're craving something that you remember eating from your childhood. But ultimately, those intense cravings that almost make you feel like you're gonna go crazy if you don't get that thing that you're craving, that is not normal. Intense cravings for sugary foods and carbs are usually linked to insulin resistance and imbalances in your blood sugar levels and high cortisol levels. But did you know that craving very salty foods may be linked to imbalances in your adrenal glands? Number 12 is recurrent infections. And specifically here, I'm speaking about recurrent yeast infections and recurrent urinary tract infections. Now, both of these may be happening as a result of other things, but if you are having recurrent infections or recurrent thrush, this may be a sign that your body's insulin levels and your blood sugar levels are not stable. And so the reason for this is because yeast loves a moist, sugary environment. And so if you are having recurrent thrush, this may be a sign that you need to go and get your blood sugar levels checked. If you are experiencing recurrent urinary tract infections, you may be having an issue with this because of low estrogen. Remember earlier I said that if you have vaginal dryness, this can put you at risk for recurrent UTIs. The reason for this is because that thinning in the vaginal mucosa can put you at higher risk for infections. Some of the symptoms of a yeast infection or thrush include vaginal itching and this really thick cottage cheesy type discharge. It's usually white in color. Symptoms of urinary tract infection include burning when passing urine, going to the toilet very frequently to pass urine. You may even have lower abdominal pain or discomfort. You may have a fever. You may feel an urgency to go to the toilet, like if you need to go, you need to go right now, and just a general sense that you haven't quite emptied your bladder. Number 13 is sleep difficulties. Now, insomnia can have a number of different causes, but fluctuations in your estrogen levels, testosterone, cortisol, growth hormone, melatonin can all lead to disturbances in your sleep. Number 14 is something we call Nocturia. Now, Nocturia basically just means that you wake up in the middle of the night to go to the toilet to pass urine. And this is often a sign that your blood sugar levels are out of balance. Now, if you've made it this far and you are not subscribed to this channel, please go ahead and subscribe. It really helps me to reach more people who need this information. Go ahead and share this video with somebody who you think it may help. And go ahead and watch this video next with 7 tips on how to balance your hormones naturally. Until next time, take care of yourself. Bye.